Hi again. Okay, so this is the second video for post-traumatic stress disorder for children 6 years and younger. Post-traumatic stress disorder for children 6 years and younger. A. In children 6 years and younger, exposure to actual or threatened death, serious injury, or sexual violence in one or more of the following ways. 1. Directly experiencing the traumatic event or events. 2. Witnessing in person the event or events as it occurred to others, especially primary caregivers. Note: witnessing does not include events that are witnessed only in electronic media, television, movies, or pictures. 3. Learning that the traumatic event or events occurred to a parent or caregiving figure. Oh, I'm down hard. B. Presence of one or more of the following intrusion symptoms associated with the traumatic event or events, beginning after the traumatic event or events occurred. 1. Recurrent, involuntary, and intrusive distressing memories of the traumatic event or events. Note: spontaneous and intrusive memories may not necessarily appear distressing and may be expressed as play reenactment. 2. Recurrent distressing dreams in which the content and/or effect of the dream are related to the traumatic event or events. Note: it may not be possible to ascertain that the frightening content is related to the traumatic event. 3. Dissociative reactions, example, flashbacks, in which the child feels or acts as if the traumatic event or events were recurring. Such reactions may occur on a continuum, with the most extreme expression being a complete loss of awareness of present surroundings. Such trauma-specific reenactment may occur in play. My mind is going faster than my mouth. 4. Intense or prolonged psychological distress at exposure to internal or external cues that symbolize or resemble an aspect of the traumatic event or events. 5. Marked physiological reactions to reminders of the traumatic event or events. C. One or more of the following symptoms representing either persistent avoidance of stimuli associated with the traumatic event or events, or negative alterations in cognitions and mood associated with the traumatic event or events, must be present beginning after the event or events or worsening after the event or events. Persistent avoidance of stimuli. 1. Avoidance of or efforts to avoid activities, places, or physical reminders that arouse recollections of the traumatic event or events. 2. Avoidance of or efforts to avoid people, conversations, or interpersonal situations that arouse recollections of the traumatic event or events. Negative alterations in cognitions. 3. Substantially increased frequency of negative emotional states. Example: fear, guilt, sadness, shame, confusion. 4. Markedly diminished interest or participation in significant activities, including constriction of play. 5. Socially withdrawn behavior. 6. Persistent reduction in expression of positive emotions. D. Alterations in arousal and reactivity associated with the traumatic event or events, beginning or worsening after the traumatic event or events occurred, as evidenced by 2 or more of the following. 1. Irritable behavior and angry outbursts with little or no provocation, typically expressed as verbal or physical aggression toward people or objects, including extreme temper tantrums. 2. Hypervigilance. 3. Exaggerated startle response. 4. Problems with concentration. 5. Sleep disturbance, example: difficulty falling or staying asleep or restless sleep. E. The duration of the disturbance is more than 1 month. F. The disturbance causes clinically significant distress or impairment in relationships with parents, siblings, peers, or other caregivers, or with school behavior. G. The disturbance is not attributable to the physiological effects of a substance, example: medication or alcohol. 6-year-olds should not be drinking alcohol. Or another medical condition. That would be really wrong. That means that parents let their kids drink or give it to them. That's just wrong. Sorry. Specify whether, with dissociative symptoms, the individual symptoms meet the criteria for post-traumatic stress disorder and the individual experiences persist or recurrent symptoms of either of the following. 1. Depersonalization, persistent or recurrent experiences of feeling detached from and as if one were an outside observer of one's mental processes or body. Example, feeling as though one were in a dream, feeling a sense of unreality, of self or body or of time moving slowly. 2. Derealization, persistent or recurrent experiences of unreality and surroundings. Example, the world around the individual is experienced as unreal, dreamlike, distant, or distorted. Note, to use this subtype, the dissociative symptoms must not be attributable to the physiological effects of a substance, example, blackouts, or another medical condition, example, complex partial seizures. Specify if, with delayed expression, if the full diagnostic criteria are not met until at least 6 months after the event, although the onset and expression of some symptoms may be immediate. So, it's pretty much the same as adults. There's some differences because it involves play and caregivers and stuff like that. But, yeah. So, I hope that was helpful. And I only have one more to do, which is borderline personality disorder. And I'm going to do that in my next video.